Sam and I'm the Chief Executive of Echo. Welcome to our Opening Doors event. Echo is delighted to host Opening Doors, our free online event for parents, carers, families and the wider Echo Heart community. Today we will hear from some people who support the heart community and those who work closely with Echo. Medical, scientific and Echo staff will talk about their experiences during the COVID-19 pandemic, respond to questions from patient, carers, children and young people, and take time to look to the future together. This event is also an opportunity to connect virtually with other Echo members, supporters and other organisations. Using the comments section, where Team Echo and some of our speakers will be happy to respond to your thoughts and comments, so please say hello and post questions. We'll do our best to answer. Today I'm really excited to share with you some hints around some new services that we are developing and sharing with you about how things have changed due to the pandemic. Today we will see the faces behind the masks of people that are known to the heart community and remind each other that the doors are still open and information, support, treatment and care is still available. Your well-being is important to us, and today we hope you can join us in our Wellbeing Heart-Shaped Wreath workshop. Don't worry if you don't finish your wreath, as we'll share a link for you to continue at home afterwards. We would love to see the finished heart-shaped wreaths hanging proudly on your doors to show that we connect the children's heart community. COVID-19 has impacted our community in many ways, and restrictions have lasted longer than most of us imagined. The past 18 months have put an enormous strain on many throughout the congenital heart community. So today we bring partners and families touched by congenital heart disease together. For now, sit back and enjoy Opening Doors, and thank you so much for joining us.
Oh, I wanna sit right here, chilling with my friends for another year. I would walk away from the spotlight for the good life. Oh, come on, turn your hate into poetry, pain into power, enemies to friends and your minutes into hours. I would walk away from the spotlight for the good life, for the good life. And they all said I was crazy for leaving my money, but it never made me happy or loud. Life is just too short to never do what you want to. What do you want to do? Oh, I wanna sit right here, chilling with my friends for another year.
Hi everybody, my name is Aaron Bell and I am a paediatric cardiologist at Evelina London Children's Hospital. And I have the great pleasure of being our clinical lead and being able to look after and support a huge multidisciplinary team. We've been dealing with the consequences of the pandemic. We've had to manage a huge amount of uncertainty, both amongst our staff and also amongst the congenital heart community. We've got many examples of staff from across the team, whether that be our admin team who are supporting booking the appointments, our nursing team on the ward or on outpatients, our physiology team that are doing all of the echoes and ECGs, and especially our medical team, both the junior medical staff and the consultants, who have really been brilliant and have gone the extra mile to support the CHD community throughout a really, really difficult time. So my main message for families would be that we're open. We're still providing our outpatient appointments, we're still undertaking our usual tests, our catheters and our surgery. Things are a little bit different on the inside of the hospital though. First of all, access into the Evelina is slightly different. They're building a new day case surgery at the moment. We're still a hospital. There are still precautions that we need to take, transmission of COVID between visitors. So we are taking steps to limit the amount of visitors that we have in the hospital. So we've been asked what changes have happened at the Evelina over the last 18 months. And it may be better to say what hasn't changed. But actually, even with the pandemic and having to manage that, there have been some really positive new things that have happened that we're hoping to build on over the next year and the years to come. I think the most important thing for us and the biggest change is the move from Savannah Ward onto Skye. Skye Ward was purpose-built for looking after children with heart problems. It's a fantastic new facility, double the amount of space that we had in the previous ward. It's bright and it's airy. We've managed to incorporate a quiet room to be able to have some private conversations when we need to. There's a new parents' room. There's hand washing facilities on entrance to the ward, which is really important. And also other quiet spaces, particularly for breastfeeding mums, where they can go to a private area to be able to express milk if they need to. One of the other major changes that we've been dealing with over the last year or two has been our increasing work with the team at the Royal Brompton Hospital. I'm sure many of you know that the Royal Brompton and Harefield are now part of Guy's and St Thomas's NHS Trust, and the ultimate aim is that we will form one cohesive service that's looking after children and families from before they're born right through until they are into adult life. And our working together is making really good progress. Echo were an enormous support for our cardiology team during the pandemic. We saw Echo as the main way of being able to communicate with the wider community about recommendations and answering so many of the questions that were coming through to our team about what to do in a very rapidly moving situation. The other thing that was really helpful is that Echo were able to show us how much support that we had from the wider congenital heart community, with support, with food packages, and just a constant acknowledgement to ask if, as a team, were we okay? At Evelina London, we're really lucky to have the team at Echo supporting what we do. One of the strengths of Echo is that it's independent from Evelina London. It's your group, it's the community's group, and it's able to provide the congenital heart community with a level of support that we're just not necessarily able to provide from the hospital. Whenever I meet a family where there's been a new diagnosis of heart disease, one of the first things that I do is actually recommend that they get in touch with the team at Echo. I think the support that they can provide family, the community that they can then become a part of, is really valuable to families, the children, and the people that support them to be able to help them navigate their way through the journey of having a child with a heart problem.
Okay, thanks for that, Aaron. That was absolutely brilliant. So I've now got some questions that our Echo members would like to ask you.
Okay, I'm a bit scared now.
Don't be scared, they're good questions.
Okay.
So the first one is from Thomas, who's 12, and he would like to know why he was born with a broken heart.
Oh, Thomas, it's a really good question. First of all, I'd say you weren't born with a broken heart. I'd say you were born with a special heart. And to be honest, we don't know why children are born with special hearts or why that happens. But we know it happens a lot. About 1 in 100 or just under 1 in 100 children are born with some form of heart problem, and you're one of those special 1 in 100s. I hope that answers your question. Not a broken heart, but a special one.
Oh, that was lovely.
Oh.
Now, I love the next question. It's one of my favourites. So Daisy, age 7, would like to know, if you could be any superhero, what would you be?
Do you know what?
Or who would you be?
Who would I be? That's a really difficult question, Daisy. And there's lots of different things to think about. Do you want to fly? Do you want to be invisible? Do you want to have super strength? Do you want to be a human form or cartoon form? And there are so many superheroes out there, it's difficult to know who you would want to be like. Let's see, I wouldn't want to be Batman because he's brooding and dark and not very cheerful, and I think I'm quite cheerful. And I want to be someone fun. I don't want to be someone who gets into too much trouble. I don't want to be someone who everyone gets a bit sick of. And I really like Pixar cartoons, and I really like the idea of running and being fast. So I am going to go with being Dash from The Incredibles.
Oh, absolutely fantastic choice. I love that, and I can't wait to see you in the dash.
And the red outfit. No, that's not happening.
I've got another question for you, Aaron,
Yeah.
and that is, this has come from a parent of a child with additional needs.
Yeah.
And they would like to know, do you and your team receive extra training on how to help these families when they come to clinic appointments and through the process, or is it just something that naturally happens?
Do you know what? That's a really good question. And the honest answer is actually we don't get formal additional training on how to speak to children, speak to parents, particularly speak to families where there may be communication difficulties. To some extent, a lot of the people that do this job do it well, because that's something that they're able to do usually quite well. During doctor training, we will often feed back to our trainee doctors about how they're communicating, give them tips about what we thought worked well, what didn't work well, and certainly if we get any feedback from families about what goes well and what doesn't, we let everybody know. I think that's a real area for development for the future, is to be the best doctors, we need to be the best communicators.
I'm Lynda Shaughnessy. I'm the lead nurse for Paediatric Cardiology and CHD Network. Within the last 18 months, we've had some challenges within the team, but it's also been a positive thing, is that we've increased our virtual presence with having some virtual clinics as well along the way. I've been really, really proud of our team and how they've adapted to these challenges. We've been working in various different ways and we've had to make changes quite quickly. So as mentioned, with things like the increase in our virtual capacity, so pre-COVID, we were doing telephone and email consultations with patients as well as face-to-face consultations. But now we're doing lots of virtual clinics, and so our team have had to learn these platforms really swiftly, had to get all of the IT equipment. We've worked really closely with our Echo colleagues in order to make sure that when we have been meeting these challenges, that we're actually meeting the expectations of what our patient population need and what the families need. So we're so proud to work with the Echo charity. They are an amazing charity, and even before I came to work at the Evelina London and within this network, I already had experience of working with this charity. So they not only look after our patients and help us with our patient care right the way from birth, right the way through to being young adults, it's also about creating a family community. So it gives people the opportunity to meet other people who might have experienced the same sort of things that they're going through. And it's different to having an experience with a charity that isn't so focused on, say, congenital heart disease. Because with all of these families that are in the Echo community, they will all have their stories of coming through a diagnosis of CHD and what that means. And they reach right the way across our network. And that's the thing that I find so important about this charity, is that it isn't focused in one hospital, it's right the way through. And I'm particularly keen on all of the work that they do with teenagers, because that's one of my real areas of interest, and making sure that our patients do continue their care onto the adult environment and don't get lost to follow-up. And as mentioned, my previous work with Echo in the past, before I came into this role, had been a lot around working with teenagers, and that was a pan-London experience. And so we were bringing patients that were seen in any of the London hospitals together, and that was really well supported by Echo. And so it's about sort of making sure that people have a voice, that people can be supported by each other, and looking outside of the medical environment. So as you know, we are obviously clinicians, and so we can provide a clinical environment and knowledge and things, but we don't know personally what it's like to have a child with CHD or to grow up with CHD, and that's where the echo community is so, so important, because that does bring a link together for people.
Thank you, Lynda, that was very insightful. Now I have a few questions for you from the echo community. So we all know how important the transition phase is. Can you tell us why you're so passionate about this phase?
So the main thing with transition is that there's actually sort of two phases really within transition. So there's the transfer phase, which is where we're moving patients between the paediatric and adult departments. And that is really, really important, because what we don't want is we don't want times where there's lapses in care. Mm-hmm. So we want to make sure that our patients move between the two departments and that they turn up for their first appointment in their adult centre. That can be quite tricky. It sounds like it's really, really easy, but actually when you're moving between a paediatric environment and an adult environment, it's things like the letters will go to the young person rather than to the parent. So whereas parents might have been always used to receiving the letters, making the appointments, making all the telephone calls, but at a time when actually you're quite vulnerable as a young person, all of that changes and goes to the young person. So that's the sort of the main reason why we're very focused then on making sure that patients do turn up in the adult service, because we want to make sure that they don't have times, if they're not going to the service, where they become unwell and they're not in a centre where they can be treated at an appropriate time.
Slightly less serious topic. Daisy, age 7, would like to know which superhero you would be.
So I would most definitely want to be Wonder Woman, but the 1970s Wonder Woman, because that's the Wonder Woman I grew up with, and it was the actress was called Lynda Carter, so being called Lynda, I would definitely need to be Wonder Woman. I also used to love, she used to have these wonderful sort of hands and sort of, and she could spin around and change her clothes, and I think, you know, I would love to be able to do that.
That's a definite talent, isn't it?
Yeah. And she always looked amazing, even when she was running, whereas the minute I start running, I look like a human tomato.
Hi, my name's Tanya and I'm a youth worker here at Echo. The idea of the Echo Teen Hub is for young people to come and meet those from the congenital heart condition community outside of the hospital environment. So the focus really is in the delivery of informal learning opportunities where young people are able to learn about self, others and the world around them. Prior to the pandemic, we would often meet up here at the Echo office and make most of London, and we'd go out on trips. We also would go to Margate, as many of the young people had not been to the beach before. Then when the pandemic hit, we took a step back and thought, how are we going to overcome this, as many of the young people that we work with were having to shield because of their illness. And then they came up with the idea for us to move the Echo Film Hub, the Echo Hub to a film hub and make this a virtual offer. We're probably about a year into it now, and the focus of the programme is for young people to make a short film that represents what Echo does or means to them. When we were thinking about the project, we thought it was very important not to just focus on the young person's heart condition. Although that is the commonality that brings us all together, it's a real emphasis on making the community, our online community, mean more than that. So the exploration of young people's identity and who they are away from their heart condition or the siblings' heart condition. I think a good sense of self is really empowering for young people, and not only for their transition into adulthood, but also their transition from paediatric care into adult care. Having that sense of self hopefully will make that transition easier.
Perfect, thank you very much.
That was a good clap, John.
Really good.
I love it. We did see a massive increase in phone calls from worried parents, especially at the beginning of the pandemic, and then actually during the pandemic. And over each specific stage of the pandemic, we would get a big increase in calls regarding whether children can attend school, should they be attending school. So
linked to like the announcements, really, wasn't it? Every time there was a big announcement, suddenly we had to get on
We had to
board.
watch all of those announcements. Do you remember when we had to divert the office phone? That wasn't easy, was it? None of us knew.
Yeah. Whoever thought you'd need to divert the office phone because the office was shut and send it to a home?
So I was going to say, like,
somebody's home.
Like operationally, how did you, obviously I wasn't here, so how did you change things around to make sure that you were still supporting families?
Some of the ways we had to work was really difficult because we had to introduce new policies. So all the health and safety side of keeping the team safe, making sure, took time.
It was quite intense, wasn't it? And, everybody's working hours were slightly different. I know I had to change mine to fit around homeschooling and things like that. And so we were kind of reacting to the needs of the community, but at the same time experiencing our own
personal issues
at the time, and just making sure it was marrying up so that we could answer all of these phone calls and emails.
I have 2 little children, so homeschool and nursery age, both at home, trying to fundraise. Didn't know what we were doing. The whole world didn't know what they were doing. I took furlough, which actually was a lifesaver because I had 2 months off. I could focus on the kids. My role isn't service delivery, so I think these guys kind of were front line there with all the families. At the same time, though, scrabbling around to raise loads of money.
We did need the funds coming in so we could support the families.
Yeah, so when I came back, which I was actually desperate to come back, and I was so pleased when I came back, but it was like, oh, whoa, okay, wow, this is amazing, because obviously we did really well and we were successful in a lot of emergency fundraising, which I credit to all those trusts out there that changed policies, suddenly flexible this, just a few questions, reporting was amazing.
Sinead, you were amazing at making sure the website was up to date. So
even though it all seemed to happen like on a Thursday or a Friday or something, that an announcement came out, we had to kind of shuffle to get it on the website in time and get it out to people before, to try and help alleviate some of the stress before people started getting in touch with us and worrying. And,
the communication was the key, though. That was it. That's what people needed. Just needed to digest the professional information.
There have been ways in the past prior to the pandemic that we could ensure that if we weren't there as a team, there would be echo volunteers in the hospital. So there would always be, or an echo volunteer on the end of the telephone, there would be somebody there to be able to support the families. And I know all that had to stop. The volunteers were withdrawn from the hospital. So suddenly we were stuck with how can we support them families in hospital. And actually they're not in hospital with their husbands, with their siblings. They're in hospital on their own as well. So, and I couldn't bear that thought. I know that was something we spoke about a lot. So.
And it was really difficult for volunteers. I remember Sinead talking to me about, could I facilitate an online training session? We did it together, didn't we, for our antenatal volunteers, so people that we were going to ask suddenly not to go in person and share their story, but to do it online.
Hi everyone, nice to meet you virtually. I'm Deanne Nowler and I'm the Community Engagement Officer for the Centre of Medical Engineering based at University of King's College London, and I work for the Public Engagement team. We're usually based in St Thomas's Hospital over in Waterloo. So we're really excited to be part of this event with ECHO because we've been working with them for a few years now, and lots of your members have been part of the projects that have worked with ECHO and with the centre and all the researchers there who are working on health conditions around cancers, heart conditions and brain conditions and development as well. The different ways in which the members have worked, the projects you've been involved with have been things like art projects where you've given us feedback around art pieces that have involved exhibitions at the V&A and also in the Science Gallery London based over at Guy's Hospital. So the relationship we have with ECHO has been really important to the centre and its researchers and our team as well. ECHO is part of our Public Engagement Advisory Board. It also includes the projects that we continue to develop with ECHO and that you're involved with, and that we make sure those opportunities are put out to you so that you can really be a part of what's happening with the development of the research around heart conditions that you might be living with as well. So we would love members of the heart community to really get involved with what we're doing, because without your information, your experiences, your knowledge of what it is to live with heart conditions, different types of heart conditions, we really don't know what impact we can make or what impact we are making. So we would love more people to be involved with our public and patient involvement groups, where they get to speak directly to researchers about the research that's coming out, to ask questions about that, to question the researchers about that, and really get them thinking about what's the best way that they can work with the heart community. We'd also love people to get involved with the creative projects we're doing. This summer we did the Happiness Hub with ECHO and ECHO members and families. And I hope some of you took part in that and did origami art and origami hearts as well. So there's different ways in which we can interact together, and it doesn't work unless you're involved. So the more you do with us, the better we can do things with you. I started my role as Community Engagement Officer in the middle of the pandemic and continued to try and figure out how to work with the communities that surround us in Lambeth and Southwark, and heart community members as well. And the team has worked really hard to take what they do so well in person and to put it online. And these skills continue to develop and grow, and we're getting better and better at what we do there. But we also are looking forward to coming back and meeting you in person, and continuing that work so we can build those relationships with you. It's been an interesting journey during this time, and I personally continue to work out how I can create new exciting opportunities for you to engage with researchers. Some of them might be online, which has been really great because it means that anyone who's vulnerable about being in person has had an opportunity to be involved still. Or those who have great distances to travel to come into London, we can connect with them online. We also still appreciate that it's really important to make sure we have those face-to-face interactions. And so we're making sure we build those back in as well. Any ideas you have of how you would like to work with us and with ECHO would be amazing if you could tell us as well. We are all up for listening to your creative ideas.
Hello everyone, I'm Nikki. I'm the founder of Studio Hoym. Hoym stands for Here's One I Made Earlier, and I supply craft DIY kits for groups and individuals to try a new skill or hobby at home without having to buy all the necessary materials in bulk quantities. Today I'm really pleased to be helping you guys with your wellbeing event for this opening doors event. We're going to be making a festive wreath. It's a really good practice to do something for your mind that rests your mind, so this will help you do that. So let's get started. In order to get going, the first step is to take a piece of string and tie a knot in the end. This is what we're going to use to hang the wreath to your door. Once you've got a knot and it's tight and secure, you want to make sure you want to put it around the ring, just like I have done here. It's really important to put it in the beginning, because you need to know where the top of your wreath is, especially if you're doing a circular one. So I would recommend that you watch this a couple of times, because this is the tricky bit, so don't lose heart at this stage. This is the bit that takes a little bit of work. You'll notice sometimes when you're cutting spruce, you have some elements can be chopped off so they look a Y, and some are a bit more pointy. If you've got both of these, it's a good idea to layer them so you've got a nice branch effect. And what I like to do, before I wire anything, I like to lay it out on the moss wreath ring so that you know how much you've got to play with. The amount of times I've done these workshops and people get to the end and they haven't got enough. So this is why we do this first. Because I'm using a heart shape, I'm going to lay out my spruce so that it's going in these two directions. Whereas if I was doing a circular wreath, I would do it so that it all followed in exactly the same direction. But as I say, we're doing a heart, so this is the way I'm going to do it. So you start by I would start at the bottom because we're going to be layering from the bottom and working our way up. The idea is that you want to cover your branches at every single stage. So I'm just going to practice layering it on first. Now with this heart shape, there's not a lot of space in the middle, so make sure that your branches are kind of splaying outwards, and that will make you a nice big wreath. You've probably got a number of sizes as well, so be sure to integrate the bigger ones with the smaller ones at the same time. That gives me an idea that I've definitely got enough. Okay, so then we start by wiring it individually. To begin, before you attach it, you need to attach your mossing wire. So at the back of your wreath, you'll be able to feel, be careful because some of the wires can be sharp, but you'll be able to feel a copper ring underneath, which is what the moss was wired to. And we want to take the end of your mossing ring and put it behind the copper, through into the back. Sometimes it takes a couple of times to poke through. Here we go. Pull it through and just thread it back through again so that it's nice and taut and secure. And then twist it round itself a couple of times. And we're good to go. So I'm going to keep what you want to do is enable yourself to be able to pull the mossing wire toward you, because we're going to need to do that to pull it taut. So here we go. You don't need to worry too much about the branches at this stage. Just over and then under, pull it, and then we layer the next bit. As I said before, when you've got a section like this, you can, let's just find a good bit to layer it with. You can pull it in like this so that you don't have too much wayward. Just a little bit more. So we're just coming to finish the top now. So as we've got an overlapping section, don't worry too much because that's probably where your ribbon is going to go. Okay, so I would recommend going over a couple more times, just pulling it really tight, and then we're going to tie it off in the same way that you fastened it on. So again, we're just going to put this through the back of the mossed wreath base, underneath the copper frame, round a couple of times. There we go. Once you've got it through a couple of times, I would give yourself 5 centimetres, and then all you're going to do is poke it into the back of the mossed ring so that there's no sharp bits when it's hanging on your door. And that concludes part 1.
I'm Kabir in Pushparajah. I'm a paediatric cardiology consultant here at Evelina Children's Hospital, and I've been working here as a consultant since 2014, but started my relationship with Guy's at St Thomas's a really long time ago, as early as 2000 when I first came here to work in the A&E department at St Thomas's. And I trained in paediatrics because that's what I really liked. I loved working with children and babies and young adults. And then I got the bug to get interested in cardiology. During my training, I really enjoyed just trying to understand the heart. And I found that ultrasound, particularly clever ways of doing ultrasound like 3D ultrasound, which I did with Professor Simpson, was really fascinating. And it's a really exciting way to study the heart because you can look at it in very complex ways and put together more pieces of the puzzle so that we can do the best to plan the right treatment or to just make sure everything's okay, which is also a really powerful tool for that. And also sometimes to try and work out if there is going to be a problem that might emerge in a few years' time, and therefore we can safely plan to do something about it so that our patients remain safe, healthy and happy. So the COVID pandemic's been really quite challenging. From my perspective, both personally and as a consultant who works within a really big multidisciplinary team in a hospital, the one thing you realise that it is a pandemic, so it affects everyone. In a normal situation, the people who provide healthcare are just dealing with a medical problem, but in this situation, everyone's had their own difficulties with the pandemic, worrying about themselves, their families or their loved ones, and at the same time, they had to deal with what is a really new condition that we really didn't know much about. And what was really quite remarkable is the fact that people were able to pull together, certainly in the team that I worked with, and get over both aspects of that. You know, having the support of your colleagues and your peers to get you through the working day, and also to have the support of your colleagues and your peers to try and solve the difficulties of what COVID was presenting us with. It's a new diagnosis, and we were able to pool our resources and our expertise, treat our patients effectively, generate new knowledge, and publish all of that amazing new research, working with other centres in the United Kingdom as well as abroad, so that the wider community of patients was able to benefit from that. From a heart point of view, congenital heart disease doesn't know COVID. You know, that happens anyway, and so we continued to provide a service for all of our patients. And that remains we're committed to making sure that our patients have the best care possible. And so we've had to think of more inventive ways of involving other members of the family in discussions. There's been many a time where we've got FaceTime and WhatsApp and all of these other technologies to try and get both parents in on a consultation so that everyone feels involved and is part of the whole discussion. The question is really about how ECHO works and helps support patients and families touched by congenital heart disease. They provide an amazing resource that I've witnessed over the years, where my patients have come away from being in quite a dark, worrying spot and are able to really get through a very difficult time. The challenge, of course, is that in order to be able to reach out to ECHO, you need to identify with them in some way. And so one of the things that we have to do is to have a very wide range of representation within all of the bits of our organisation in the hospital as well as the charity, so that people will relate to what we're trying to achieve.
Oh, thanks Kuberan. So nice that you spent time with us today. I'm not letting you go just yet. I have some questions from the ECHO community for you. Okay. First one is from Luke, aged 20. Luke wants to exercise but spent a lot of time through his childhood being told to rest or avoid sport. He's a little bit confused about what is best and wonders, is there a scan or a test that you know of that he can take to tell him what exercise he should do?
Okay. Hello, Luke. I think it's amazing that you really are thinking about exercising, because it's really important for everyone to exercise, including myself, and I should listen to that. The main thing is to actually feel safe with the level of exercise that you're able to do. And I think it's important then for you to have a conversation and ask your cardiologist and the clinical nurse specialist who's in your clinic and talk to them about your concerns that you have about exercise and the type of exercise that you want to do.
So a really challenging question next from Daisy, age 7.
Okay.
If you could be a superhero, who would you be?
Okay, Daisy, you got me there. Well, I work with MRI scans a lot of the time, and MRI scans are big magnets that are able to take amazing pictures of your heart. And I don't know if you've watched the X-Men, Daisy, but there's a man in there called Magneto, and he's got powerful hands and brain that can move things, and he's like a super magnet. And I always think it's pretty cool that Magneto can do all of that, and so sometimes I wish I could do that. Of course, Magneto, he's not always a good guy in the movie, but in his heart of hearts, he's a good man, so don't worry about that.
Well, it's our first baddie of the session, so that's great.
Okay, hi, so my name's Dr. David Lloyd and I'm a fetal and paediatric cardiologist at the Evelina. And I'm involved with a lot of research looking at new ways of diagnosing congenital heart disease before birth. So that means we need to use different types of scan to see babies' hearts while they're still in the womb. And that can be with ultrasound or with MRI scans, which is another detailed type of scan that we can use. The things we're looking at the moment is just trying to get 3D pictures of the fetal heart. So trying to get a detailed three-dimensional picture or model of the heart that can help us understand exactly how the heart has formed. And now we're extending that to even look at other things like how does the heart work, how is it functioning, how is the blood flow through the heart moving in 3 dimensions, and how does that link up with other parts of the baby's growth, so how big they are, how their brain's developing, and things like the placenta, how's that working in the mother's body. So those are the types of things that we're looking at, and we're hoping that by putting all those things together, we can understand a little bit more about how we can diagnose congenital heart disease better, and also maybe even understand why some forms of congenital heart disease form in some babies but not in others. I suppose our hope is that when we diagnose a heart problem before birth, often that comes with a little bit of uncertainty. We can be a little bit limited about what we can see, certainly using traditional ultrasound scans. And that uncertainty can be really difficult. It could be really difficult for me as a doctor, but really difficult for families too, to understand what this diagnosis means for their baby. So the more detail that we can see using these extra new types of scan, the more we can reduce or even get rid of that uncertainty and say it's really clear, we know what's happening, we know how to treat your baby, and we can then communicate that to our patients. Okay, so this is an example of a baby's heart, and we have printed this from a 3D model. And this is to scale, so this is the real size of that baby's heart, and we took this with an MRI scan while the baby was still in the womb, still moving around, and we were able to get lots of different pictures of their heart and reconstruct them into this 3D model. And this is actually a baby's heart in the 3rd trimester of pregnancy, so after 30 weeks in the pregnancy, so coming towards the end of pregnancy, and you can still see how small it is. And the reason why this is helpful is if you look at all these little blood vessels here, there's lots of small blood vessels crisscrossing each other, going on all different types of pattern. And it's really, really difficult to work out exactly how they're all connected to each other when we're just using those 2-dimensional, those flat pictures from an ultrasound scan. So having this information is really helpful to, as I was saying earlier, remove some of the uncertainty about exactly what's happening. We can see with our own eyes in 3 dimensions exactly what's happening with the heart, and that's helpful for us as doctors, but also for families, because we can show them just exactly what's going on and explain what it means for their baby and how we treat it.
Well, thank you, David. That was really interesting. We love hearing about all of this. It's amazing. So now we've got some questions for you from the ECHO community. Are you ready?
Mm-hmm.
Great. So first up, we have a question from Thomas, who's aged 5, and he has asked, how can doctors know what is happening to poorly hearts inside their mummies' tummies?
So that's a really good question, Thomas. And I think part of what you're getting at with that question is that it's really difficult because babies are really small. They're inside their mummy's tummy, and their hearts are even smaller. So they can be down to the size of even just like a 5-pence piece. And in that we have all the different chambers of the heart, the valves in the heart, and all the blood vessels around the heart. So it's really, really tricky. The things that we use are ultrasound scans. So that's a kind of jelly scan where we put jelly on mummy's tummy and use an ultrasound to have a look. And that's very similar to the echo scans that we do on children to look at their hearts after birth. And in St Thomas's we also have a different type of scan we can use in pregnancy called an MRI scan. And we're one of the very few places in the world that use that type of scan. It's really safe to use in pregnancy. It's just a big magnet. And that can give us some really detailed three-dimensional pictures of babies' hearts, even when they're so small. So those are the types of things that we use to see mummies inside mummy's tummy and see the little tiny baby hearts in there too.
Oh wow, there we go. Hopefully that helps answer your question, Thomas.
And you know, we're still going through it. It's still very much different for each family that we support, and we know and recognise, you know, that some of the young people that I talk to or families are still experiencing real hardship.
Is it, you know, during the proper pandemic, like, the children's parents weren't allowed on the ward, were they?
There was always, well, mostly one parent was allowed, and in the first lockdown it was so strict that parents couldn't swap. So that meant that there was just one person, or sometimes they were given an option of having like two people swap over. But I know that the carer parent who was on the outside could feel quite isolated and like they weren't involved in conversations. But we have heard, even in today's event, of great ways that the medical team embrace that by using WhatsApp, video calls, messaging.
For any of us who've ever spent any time in hospital with children, just that knowledge and understanding of what people were going through and that you weren't able to have both parents there, how difficult that must have been as a parent or as a carer, and for the staff as well, who have been so used to having that and understanding how much of a support that is for people. That's been really, really difficult for all of us, I think. So it's been really nice that we've been able to do what we can to try and continue to support people.
Something I really like is the postcard that is in the Echo Cares pack, for example, to connect siblings, because we know that being a sibling, being a young carer comes with all kinds of responsibilities, and for them to be out of the hospital, it's really challenging.
We spent quite a lot of time thinking about what we could do to sort of replicate some of our services really and make sure that we were reaching out to people, and for a long time we'd been wanting to put something inside the hospital, and so that's another really good story to come out of this, is that we now have our Echo Cares pack which goes in, so all inpatients receive that. And we've also been working on a really exciting new magazine, haven't we, for children?
I'm so excited for this.
And that's going to be what, for 5 to 11, is it?
Yeah,
that sort of age range?
Be for sort of young primary school age children who are staying in hospital.
My name is Rachel Sparks, and I'm a lecturer in the Department of Surgical and Interventional Engineering at King's College London. Normally, what I do is develop computer programs to help analyze medical images for patients who are going to be undergoing neurosurgery. And this information is used to help neurosurgeons figure out how to safely and effectively do these procedures. Typically, the patients I'm working with are patients with epilepsy. However, during the pandemic, most of these surgeries were completely stopped for the safety of the patients, so my research area really changed. And what I ended up doing during the pandemic was looking into a COVID-specific project. So these were patients who ended up in the hospital with COVID. And what we were interested in looking at is how their heart health had an impact on the role of COVID and their outcomes. And specifically what we were looking at was there's a thin layer of fat around the heart called pericardial fat that if you have more fat than normal, you will tend to have a more inflammatory response. And so what we found in general was patients who had a higher volume of fat around the heart tended to have worse COVID outcomes, so they tended to be hospitalized for longer and ended up in the ITU compared to patients with healthier hearts or less fat around the heart. And really the end result of this research is now we have a better understanding of what factors to look for when we consider which patients need to have treatment for COVID. In terms of my research going back to normal, it's a bit of a mixed bag. So they are beginning to do procedures with epilepsy patients, so I'm still supporting that research. But we still have a lot more questions to ask about the COVID patients. Specifically right now I'm working with some endocrinologists looking at if we can pick up specific markers in the blood related to the pericardial fat so that we have an easy screening for patients who might have potentially worse outcomes for COVID. So in some ways it's actually been very beneficial for my research because I've expanded into a whole new area that I wouldn't have considered if COVID hadn't occurred.
Oh wow, that is so interesting, Rachel. It's really amazing to hear about what's been happening in the research world, and we all look forward to hearing more about that soon. So I've now got some questions for you from the ECHO community. The first one is, what do you love about being a research scientist?
So one of the things I love most about being a research scientist is I get to meet all sorts of experts in their field, sit down and have a conversation with them about what they find challenging or difficult to do, and then come up with a unique solution, typically using computer software because that's my specialty, that can help them, essentially deal with parts of their job they find difficult or challenging.
Oh, wow, thank you. The next question is a good one. It's from Daisy, age 7, who would like to know, if you could choose to be any superhero, who would you choose to be?
I think I would choose to be Wonder Woman for a couple of reasons, but the primary one is I think she's just, a really strong, powerful figure. She also has the lasso of truth, which I think as a researcher, that's part of my job, is finding out what the truth is.
Oh, I love it. Amazing. And the final question for you is, have you got any past jobs or activities or hobbies that would surprise ECHO members to know?
I think, well, this is a big one. I think one of the things that is a hobby of mine that might be interesting for people to know about is I actually really like long distance hiking. So this is typically week-long hikes. So I've hiked through the Cairngorms for like 7 days in a row.
Wow.
And it's very fun. It's basically bring, all the food, all the, your tent, your sleeping bag, etc. And you basically go and spend multiple days out in the wilderness.
Oh, that sounds amazing. Well, thank you very much.
Hi everyone, welcome back to part 2. If you're following this along with me today, then hopefully you've got something that resembles this. We're going to crack on. Now that you've got your foundation, we're going to put some foliage in place. And I always like to start with eucalyptus, which smells amazing. This room smells amazing because I've got quite a bit of it in here. So with eucalyptus, what you want to do is give yourself enough of a stalk. So I always take the first couple of leaves off and just discard them and have a little whiff at the same time. Sometimes you'll get a piece that has lots of branches coming off of it. Others you'll just get to other sections. I would recommend putting them in together. And before I start anything, everything that we're going to add is in threes. Odd numbers just generally work well anyway, but when you're doing things in threes, it means you can populate in between those. Everything will become clear, but 3 is the magic number. So I'm going to start by plotting my eucalyptus in the top, and I'm just going to poke it in between the spruce. Ideally it would go into the moss, but your spruce is probably quite compact at this point, so it's not absolutely necessary. And then I'm going to place the others. We are going to secure them, so don't worry, these won't fly off in the wind. And in order to secure them, we're going to take your floristry wire, and if you imagine this is in thirds, you take 2/3 and then you bend it to make a hook at this stage. The reason why we bend it to make a hook is so both of these parts go in between either side of the stem and hook it in place. So because you've got 2 separate bits here, what I'm going to do is try and gather them a little bit and go either side of the stem. And what we want to do is for the wire to go through right the way through the back of the moss. Now you might need to do my little tip of holding the wire as close to the tip as possible, and then you can see it coming through the back. And as we did before, we want to protect your door. So we're going to fold this back on itself and poke it back through the end of the moss with both sections of wire. Okay, so you've got things in threes. And I'm just conscious that our bow is going to go here, so it might look a bit naked up here, but that's just fine. Now we're ready for some colour. And I've got some berries, again, in threes. Some sprigs will be nice and full of berries. Others, you might want to get 2 small ones and combine them. So again, we're going to use exactly the same principle, but first, we just want to place them just so that you're happy with your positioning before you start. And again, we're going to do it in threes, so I might put mine right at the bottom. Exactly the same principle as before. I'm going to make that into thirds and pin it in place. Don't worry, because all of the dried goods are then going to fill in the gaps and just go on as like a top layer, which will make it all come together. So now you've got all your foliage. Should it look something along those lines. That's the end of part 2, and I'll see you for the next part where we add the dried stuff.
Hello, my name is Owen Miller and I'm one of the paediatric cardiologists here at the Evelina London, but I've also got another couple of jobs that I do. So I'm also the clinical director for the Congenital Heart Disease Network, and then my third job is one of the most exciting at the moment, is the new clinical director for the new Directorate of Cardiology, Respiratory and Intensive Care as we join forces with the Royal Brompton going forward. So that's going to be the main job over the coming months. So you may wonder, what do we mean by the Congenital Heart Disease Network? Well, the network is really a relationship we have with all of our hospitals in our region. So over the decades, we've built up professional relationships with hospitals in our geographical network, and they know who to call. They know who to call when a baby is born with congenital heart disease. They know who to call when the child needs surgery. And we've established a whole raft of support measures, including joint cardiac clinics in the local hospital. And what we're trying to do is we're trying to be able to deliver Evelina London level of care closer to home, and that the professionals, the nurses and the doctors at your local hospital can just pick up the telephone, can know the Evelina way of doing things, and they know who to call if there's a problem. Okay, so during the COVID pandemic, the network hasn't been lying idle. We've been pretty busy actually. Because we haven't, during the lockdown periods, been able to do as many clinics in the local hospitals as we wanted, we still had to make contact both with the clinicians and with the families. So a lot of the cases we were able to manage together with families and local clinicians through telephone clinics, or having local triage in the local hospital and then talking to us about any intercurrent problems. But through the pandemic, we also scheduled regular phone calls with our clinicians in the local hospitals so that they were up to date with what we were doing, what the local advice was, what the current NHS England advice was regarding to COVID. So the pandemic provided us with new challenges, but I think we also learned new ways of working. And I think we're not going to go back to the old way of working entirely. We're going to take those things we learned from the pandemic and continue those going forward. 2022 is going to be a big year. So at the beginning of this year, 2021, we merged with the Royal Brompton. They now sit within the Guy's and St Thomas's Trust. We're also looking to merge the networks. This will be a huge task. Nowhere else in the UK have any congenital heart networks merged, so this will be the first time that happens. And when we do merge, we'll have a huge network which covers all areas around the compass, around London, north, south, east and west. And so we'll have large areas of responsibility, new areas of responsibility. We're going to have to work very closely together with the Royal Brompton and their network team.
So one of the mums wants to know dental hygiene and teeth, and people saying, you know, what do they need to be aware of, and especially when they approach dentists and they're being sent back to the Evelina to see the dentist there. Do you have any words of wisdom about dental hygiene for children with heart disease?
Yes, I do. So I think, we mention this in pretty much every outpatient visit. Teeth are really important. Dental hygiene, gum care, tooth care is really important. And lots of families ask, well, what's the link? The link is that if you get germs and dental decay, those same germs that are in the gums can go to the heart. So it's really important for families to start teaching dental hygiene at a really early age for their kids, and to get them into the habit of toothbrushing, regular visits to the dentist or the hygienist, and most importantly, a sensible, healthy diet. Not too much sugar, not too much sweet food, because that is the worst thing for teeth. Now, dentists, we have a good dental team here. You ask about that. We have a great dental team at Guy's and St Thomas's, but we don't want all children to come to the Evelina for their dental care. Some do, if they need dental surgery or if they need extensive work, then some of those will be referred in by their general dentist to the Evelina for dental surgery. But most families can have their usual care by their usual dentist, but they just need to also take a bit of responsibility at home for instilling really good dental hygiene practice with their kids from a very young age all through their life.
So Owen, I've got a really good question from Daisy, who is 7.
Okay.
And she wants to know, if you could be any superhero, what would you be? Or who?
Superhero questions, not my strong suit, but the way I look at it is when I look at all the patients that I look after, they're the superheroes. So for me, the kids are the superheroes, the parents are doing a great job, Echo's doing a great job. I don't think it's my role to be a superhero.
Well, I think the community might disagree, but that is a really great answer and really lovely.
I'm one of the Tower Team midwives at St Thomas's. Tower Team are a team of specialist midwives in maternal and fetal medicine, so we care for women whose babies have been diagnosed with cardiac conditions. The pandemic has affected the way our team has supported parents slightly, mainly in terms of our classes, which have just moved from being face-to-face to online via Zoom. So we do the same amount with the same people and the volunteers and the NICU nurses, just with virtual tours and pictures of equipment that we use instead of showing you face-to-face. So Echo supports us and the families really well at St Thomas's and in the antenatal period and afterwards as well. They have provided lots of online support, support back and forth when parents aren't in the hospital or when we can't see you face to face, and a lot of feedback has been from parents seeing the volunteers, seeing the pictures of their babies in hospital so that they can try and prepare and mentally sort of prepare for what it's going to be like when it's their baby in hospital. We would refer all of our families to Echo who are going through the journey, especially from the antenatal period, to support the whole family, siblings, parents when they're in the hospital, support when they're back home in the community, meeting up with other parents in their area, and trying to make the pregnancy still fun and exciting, even though there's a few other things going on.
So thank you, Nathalie, for talking about all of that with us. We have now some questions from different members in the Echo community that I'd love to ask you.
Yeah.
The first one is from somebody who's wondering, how can they manage their anxiety when they're waiting for the arrival of their baby who's been diagnosed with a heart condition?
Absolutely. So I think talking to different professionals is key. So speaking to your local team, even if they are not the ones who will be there at the end of the pregnancy, you can already start speaking to them about ways to manage anxiety, speaking to us, to the Echo team, to the Cardiology team, and just asking as many questions as possible, and finding routes of useful information that are more specific to you, and talking to friends and family. Even if they haven't gone through the same thing, they can still help you prepare and put plans in place for when your little one does arrive. I think that's really helpful and probably one of the most helpful parts, because it's someone who's been there and has been through it and understands where they're coming from more than anyone else. Can give tips and tricks that we might not think of, or that doctors might not think of, but they learn from being in there themselves. They show images, if people are happy to see them, they show images of their little ones in intensive care, even intubated, and so if you've never seen that before, seeing that ahead of time can be really, really helpful, and asking questions to someone who has had it all themselves, I think is key to preparing and to feeling ready.
lockdown, it became clear to us from speaking to ECHO members that it would be really helpful if we were to provide a new platform enabling members to ask questions, find information, and speak to others who are going through the same experiences as them. Through this, we have brought in Vashti, who's our new community coordinator. Vashti, can you speak a bit about what you're going to do?
Yeah, so the new forum will be a safe space which will be moderated and owned by ECHO. It will provide an opportunity for our membership to actually connect on a deeper level and to go into more depths in topic areas, and we'll also be providing a service where we can signpost to other relevant organisations. In order to fully deliver this new service, we really want your help to shape how the forum is delivered. So our call to action, if you like, is for people to either join a focus group or to volunteer to moderate the forum. So what can you expect when you log on to the new ECHO forum? Designated threads with specific topic headings, easily accessible information that is retained within the forum, signposting to relevant organisations, and open discussions between other families where you're able to share your experiences and possibly your top tips for coping with different situations.
We're really excited that we're able to deliver this for the ECHO community. We're building this in response to your requests, but we really need you to get on board. The only way this is going to be really, really good is if you guys get involved and you help us moderate it, and of course come and join us in the community and ask questions in the forum. So yeah, we'll be announcing its launch very, very soon, so watch this space. Thank you.
My name is Professor Shakeel. I'm at Qureshi. Everybody knows me as Shak. I'm a consultant paediatric and adult interventional cardiologist. So what that means is I do keyhole procedures on babies and all the way to adult life. I'm based at Evelina Children's Hospital and St Thomas's Hospital here. There are many types of complex and simple heart defects. Many of them can be treated. There are some in which we have multiple staged operations. Now, the important thing with all of these heart defects is we encourage children and young patients with these heart defects to undertake regular exercise. That has been a problem during the last 2 years almost because of COVID, and so people have done less exercise than they ought to have done. But it is very important to do regular exercise. There are some heart defects, for example, complicated ones like Fontan operation, where it is important to have leg exercises, building up your leg muscles, because the heart relies on blood returning from the legs. So that's one area which is actually underemphasized, that you need to do exercise, especially involving the legs. It's not just arms, but legs as well. Other heart defects, there are no particular types of exercises that we recommend, but all dynamic exercises are very important. And all of those will then lead to better health and better function in the longer term.
Okay, so thank you very much for that, Shak. That's absolutely brilliant. Thank you for that. I've got some questions now from the ECHO community that I would like to ask you, if that's okay.
Yep, that's fine.
And the first one is it recommended that patients wear medical bracelets, and what benefit do they have?
Well, patients occasionally will have some emergency problems, and they may be a long way away from specialist centres. Locally, paramedics, local hospitals may have to start some treatment urgently. And if they do not have all the information available about what treatment may have been given previously, what operations may have been done, what the heart defect was, then it may take them 1, 2, 3 days to get all that information and make decisions. That means the decisions for treatment or appropriate treatment are delayed. If you have a bracelet with all that information on it, about which hospital, what type of heart defect, then the local teams can act swiftly, and within minutes they will have that information and make correct and appropriate decisions.
That's brilliant, thank you. Thank you for sharing that. And my last question of the day for you, Shak, is what activity, job or hobby have you undertaken that would surprise the echo community?
I don't think people think of me as a sporting sort of person, but a few years ago, I used to play cricket before, but a few years ago I took up golf. And so for the last few years, and especially during the lockdown, when the golf courses have been open, I've played a lot more golf than probably I would have done or I should have done. So that's been one. And then the other thing that's happened because of that charity work that I do and teaching work that I do overseas, the perception in those countries with the lockdown here was, and elsewhere, was that I had time on my hands and so I could help. So with the technology, using Zoom, using Teams, using WhatsApp video links, many of these people, all friends, who wanted to do keyhole procedures on children with heart defects, asked me to sign in or join them on those video calls. And then I would spend 1 hour, 2 hours, 3 hours sitting there and talking them through a particular procedure, simple procedure as well as complex procedure. And so that's actually been a rather surprising development, because prior to this, prior to the COVID, over the years, I used to fly to these different countries to help and do these procedures, whereas now it looks as if there is a more efficient way of doing it.
That's fantastic. That's going to surprise a lot of people. It certainly surprised me. So thank you very much for that, and thank you for joining us today.
Thank
we
you.
really do appreciate it.
Thank you.
So thank you.
Hello everyone, welcome back to the third and final part of your festive wreath session. I hope you're enjoying yourself. I hope you're feeling really relaxed. I know I am. It's been great to be part of this so far, and I know that I've certainly found all the speakers completely inspirational, so I hope you are too. So let's crack on. Now we're going to do the fun part, so we're going to put all of the dried elements onto our wreath. We'll start with the biggest element, which is the lotus heads, and with these, and actually with any of the dried bits, I would suggest that you just poke them in to begin with to check that you're happy with the placement. So I'm going to stick mine around about there. Again, remember we're doing things in threes. Some people might even choose to go off-piste and do everything all in one corner. That's absolutely fine. Everyone should do something that is unique to them, or you can follow me. Either is good. There we go. I've hit a branch, there we go. Now with these, the good thing about these is they're so big that when you're positioning them, you've got a few sides and a few angles, and if it's going to be hanging on your door, people are going to see it from all angles, because you might have tall, short people from the side. So if you angle them in different directions slightly, just brings a little bit more dimension into your wreath. So once you've got both sections of the wire through, give it a nice tug so that this is nestled in. And again, you just want to poke the wire back through to keep it secure. And I'm going to continue to do this with all three, making sure that all three go through the moss and not just through the spruce. It's so satisfying when it comes through. Not so much when it doesn't, but keep persevering. Okay, so and the last one. I'm going to angle this one outwards. Okay, then we're going to add our pre-wired cones. where to place them. Okay, so I'm going to pick a couple of areas and then see how it sits. And I quite like to layer things on top, so just because you've got some foliage there doesn't mean you can't put a cone on top. And actually I've got a small one there, so I'm just going to put that one down there and sit this one at the top. Again, as we said before, with the lotus heads, you can angle them so that they're coming out slightly angled, which gives everything a bit of dimension. Sometimes, like this time, I just can't see where the wire is coming through. There we go. Sometimes it's quite difficult to see. You just got to make sure you get, I've got enough to be able to bend it back into the moss. That's your cones. Okay, and then my favourite part is when we add the orange slices. This is when it really starts to pop. And some people put a singular one in. I like to put doubles because I like the split and it gives it that extra bit of clout. So again, I'm going to position them. I want to give them quite prominent positions. Okay. Lastly, we've got cinnamon sticks. And these are just going to go, it's getting a bit full now, so we're going to pop them wherever there is some space. But nicely, hopefully, we can get them further apart. Okay. Now, we should have some space left over for our ribbon, which is like so. So this is going to go on at the top here, but it doesn't matter if the ribbon's too long. Better to have it too long and then to trim it afterwards. So it's exactly the same principle as before. We're going to put this through the top. There's our wreath. And there's one final touch that I'd like to add. It's just a nod to our Echo Heart charity. And I'm just going to add this charm. So that's it, everyone. I really hope you've enjoyed today. I know I have. As this event is named Opening Doors, it would be absolutely wonderful for me to be able to see, and for everybody that's taken part in this event to be able to see the results of your festive wreaths. Tag us on social media, on the Echo social media, just so that we can see how you've got on. That would be great. And I've really enjoyed being part of today. It was an absolute honour. Hope you've enjoyed yourselves. Thank you.
Emma, the kind of activities and groups are starting up. I know you're talking about 2022.
Yeah.
You've got like lots coming up in February, and we're thinking about another Up and Over, aren't we?
We're definitely going to be doing another Up and Over because it's been such a wonderful event. Everybody to see, I mean, I've never actually walked up and over myself, of course, but watching everybody else walk up and over has been phenomenal.
I'll fundraise for you to do it.
We're all sponsor Emma for sure.
I walked into that one.
So sorry, Up and Over is the
O2.
The
O2, yeah. And we've had the most incredible bunch of young people and volunteers.
Nathalie has actually got I did it. Yeah, it's lovely. It's such a nice, like, we might as well have been climbing Everest, do you know what I mean? Like, the journey up it's just so nice. And then when we got to the top as well, like, by the time we get up, even if there's young people at the events that don't know each other, by the time you get to the top, they're all talking to each other.
Yeah.
And then clambering their way down. But amazing event. And up the top, of course, you get such a lovely view. But yeah, I'd do that one again.
Yeah, I've got your name down.
Yeah, I'd do that.
I really like that event because it's not just a fundraising event, it's an empowering event for young people with congenital heart disease or their siblings. We've had cousins, lots of young people take part.
Yeah.
And then after this, which is a big challenge for many of our young people, big physical challenge, we then go for lunch in the O2.
Yes, it was wonderful, yeah. No, and that was a really nice time as well. We gave certificates out there, said some nice, I believe every a group leader said, said some nice words about their specific group, and you could just see on the children's faces how much it meant to them to walk up and get that certificate, because they really deserve that certificate. It is a massive challenge. It is a big physical event, isn't it?
One of the real positives for us to recognise was that we have such a great relationship with hospital, and so we were able to contact people, get really good informative answers when we needed them. And then just work together to make sure we were updating our website.
I think
all the time.
daily we were updating we had a dedicated page on the website, and every day we're just checking what was the latest update, what was the latest information.
So, and I guess being able to access that information kind of hinged on the relationship that the charity's built over the years.
Yeah, definitely. It's definitely something I think that has we've definitely built on over the years, and has really become a real positive, actually.
Yeah, can't wait for physical spaces. I've got goosebumps there.
Well, it's been so nice, obviously, making our wreaths together, and you two, someone's done really well. These are not wreaths that were made earlier. These are wreaths that we've struggled to make. So, great. Thanks, guys. Look forward to more working together.
Yes, absolutely.
Thanks.
Hello everyone, my name's Nathalie Chung. I'm one of the consultants in the adult congenital heart disease team. So that means that I'm an adult cardiologist and I specialise in congenital heart disease, and I look after patients from the age of 16 upwards. But actually I work with our paediatric cardiology colleagues and see some patients from the age of 14 jointly as we help patients progress from the paediatric service into the adult services. So I'm the lead for the service, and my interests are transition, so that move from paediatric cardiology into adult cardiology services, and I also have an interest in pulmonary hypertension, which is a condition which is quite common in patients with congenital heart problems. So a lot of patients and their families actually are concerned about what happens as patients move from their paediatric cardiology care into the adult congenital service, and how to best facilitate that. What can you do as a patient or as a family to make that transition safe and also effective as well. So we like to see patients together with their families in the adult services as well as in paediatric services, and it's totally up to patients as to who comes with them into a clinic appointment with them. So that is helpful in having a second pair of ears when you're talking to either one of our nurses or one of our doctors, because often you forget what we've said. So having somebody else in the room with you helps to act as a memory aid for you. The other thing that people are concerned about is what happens to their clinic letters. Do patients get the clinic appointments? Do their parents get the clinic appointment letters or text messages? And actually, once you come into the adult services, most of the correspondence, so that's letters, appointment details and text reminders, go to the patients, unless you have a reason or a request for things to go to somebody else in the family or one of your carers. And the other point about having our nurse specialist team is that you always have a contact, somebody to phone if you're unsure about what to do next and what appointments you need to attend or don't need to attend. The other thing that people often ask us about is what can we do ourselves to try and improve our health for the long term. And most of it is really around just the healthy lifestyle advice that everybody has. So your brothers and sisters, we'd give them the same advice as we would to your parents or to your grandparents. So it's about having a healthy diet, not smoking, not using recreational drugs. A little bit of alcohol in most cases is fine in moderation, and making sure that you stay active. Now, active is a word that many people don't understand or are not sure what active means, and some of our patients are more limited than others, but essentially trying to do as much as you can, as much as your heart condition allows. So if you can walk for 100 metres without getting breathless, but you might start to get a bit tired, then that's okay. You should try and do that a few times a day. If you can actually walk for 10 miles non-stop, then that's great. You could do that maybe once a week or whenever your exercise program and your schooling or your working lives allow. So keeping active is very individualised, and you can always chat to your team that's looking after you to find out what you can and can't do. But keeping active is generally a very good tip that we would recommend. And then the other thing just about keeping safe is if you are on medications, so talking to your family, talking to your doctors and your nurses from an early age, you know, so maybe from the age of 14, 15, 16, depending on how well you can keep up with the information that you're receiving, to get a feel for which tablets you need to take, remember to take yourselves, and also to start to learn about how you might get prescriptions in the future. And that's information that might take several months or sometimes even a couple of years for people to really get to grips with that. And that's fine. That is very variable, and it just depends on individuals' setups in terms of how well they can take on those responsibilities. But generally, in the background, you've got your parents, you've got your families and your carers, and you've got our medical teams, both the paediatric and the adult teams, to help support you with that. And also, don't forget, Echo is there as well for advice.
Thank you, Nathalie. That was really wonderful. I've just got some questions from the Echo community that I'm going to ask you. Firstly, this one is from a 15-year-old. I'm worried about leaving the Evelina behind. I know all of the people and they will always remember me. What's it like when I come to the adult hospital?
Okay, great question, and actually a question that we're asked a lot, both from patients and from parents and families as well. So the setup in the adult service, as I've described before, in terms of the team, members of the team looking after you, is very similar. So you'll have a team of doctors and nurses, our hopefully psychologists in post, and our admin teams as well. The other thing is that there's lots of support on the ward, so our nurse specialists are on the ward all the time. So if you're feeling a bit afraid on the ward or not sure what's going on, then people can always ask the staff on the ward to get in touch with our team, and our nurses can come up to ward, you know, during the daytime, several times a day if needed, to help make you feel better and less anxious when you're in hospital.
And another one from a 19-year-old patient would like to ask, now I'm in a relationship, I don't know how to talk to my partner about my heart. Could they come to the appointment with me instead of my mum?
Absolutely. So when you have appointments in the hospital, you can come by yourself, you can come with your mum or dad, you can come with your best friend, you can come with your new partner. It's really up to you, the patient, who's with you in the clinic appointment with you. If you're not sure how to talk to your friends or your partners about your heart condition, that is completely normal, actually. A lot of people have problems just knowing how to bring up their heart condition, what to tell people, how much detail to go into. And that's very much an individual choice about how much you want to tell people. But we're always here. If you want your partner to come into an appointment with you, we can always explain things on your behalf if you'd like. You just need to ask us, ask your doctors or your nurses if you need some help with things being explained to a new partner.
Okay, so my name's Joanna Ison. I am a trustee of Echo and also a paediatric emergency medicine doctor, currently working at the Evelina, but in the past I have worked at various hospitals. Throughout this pandemic, I've been really impressed with how Echo has responded to how it supports children, families, young people, and also how the team has managed to support each other and reach out and support everyone else. I think Echo was really early in realising that something had to change and that we had to respond, and immediately tried to think about ways of making sure that we could move everything virtual. So obviously closing down the office had a major impact on how we were able to work and how we were able to reach out to people. I think they did a really good job of still managing to support people even though we weren't physically present in the office as we used to be. I think over the last 2 years, Echo's done so much. To pick out one thing is difficult. I think for me personally, one of the biggest things has been getting Echo's details on the bottom of the clinic letters that the hospital put out. And people may not have realised, but you know, Echo doesn't just support families in the Evelina, we support families and children and young people that have been supported by the Evelina, even if you're now in your local hospital. And having worked in these hospitals before, I've seen how visible Echo is or isn't, and how difficult it sometimes can be to say to families, actually Echo are still here for you, we're not just here at the Evelina. And so by getting the Echo's details on those letters that go out to all of the families, wherever they are, wherever they're living, wherever their local hospital is, to say that, you know, you're still part of the Echo family and we're still here for you, is so important. And to be able to do that through the hospital, through an official clinic letter, as opposed to just us sending out correspondence to people, I think makes such a difference. And it, you know, it speaks to our relationship with the hospital, with us working with them but not being part of them and being separate, and just being here to support the families but of these children. So I think for me that's been a major achievement. It's something that I can see in my day-to-day work when I'm out and about, actually see Echo out there and no longer be saying, have you heard about Echo, and kind of waiting our parents, actually, have you heard about Echo, they're on your letter, please contact them, the details are there. So I think that makes such a difference. Over the pandemic, as a board, we had to meet more regularly. It went without saying. I think all the board members were really passionate about making sure that Echo still functioned and that we found ways to move forward, and that just meant that we had to check in more regularly with each other, check in on how the team were doing, and just make sure that we were making decisions quickly and responding to things as and when they arose. So we were obviously meeting virtually, but we were meeting a lot more regularly and had to increase our frequency just to manage the ever-changing situation throughout the pandemic.
And we now have a couple of questions from the Echo community that I would love to ask you. So the first one is, what do you personally most look forward to about Echo in 2022?
I think going forward in 2022, I think I most look forward to Echo being able to reach out to a wider community and reach the families in the local hospitals and just expand our network as Echo continues to grow.
And one other fun one about you is, do you have any kind of secret hobbies or interests that people might not expect when they know you?
I'm not sure I do. What I would say is that I spend a lot of time planning to do exercise and not actually doing it. Like a lot of time, like I could tell you about any local class, any local activity, any local run, and you won't find me there, but I will know it's happening.
I mean, that sounds like a hobby in itself.
Yeah.
So, yeah.
Oh, I wanna stay right here, chilling with my friends for another year. I would walk away from the spotlight for the good life. Oh, come on, turn your hate into poetry, pain into power, enemies to friends, and your minutes into hours. I would walk away from the spotlight for the good life, for the good life. And they all said I was crazy.
So much for taking part. We really appreciate all of our speakers, guests, Team Echo for presenting, and for the Echo community for sending us those fabulous questions and comments. Opening Doors was Echo's opportunity to connect the heart community, and I'm especially grateful to our speakers and staff who shared some personal insights, giving us the chance to get to know them better and to remember some of the amazing things that have been happening over the past 18 months. Some of our conversations today are about everyday issues that a heart family face. This was important to us to cover because congenital heart disease continues throughout the pandemic. We know that COVID-19 is still with us, and we understand the challenge that that brings to the heart community. The pandemic has touched us all in deeply personal ways. Children haven't been to school, households have lost work or income, elderly relatives and family members falling ill, fear of the unknown and impact on our families and lives. We are all hopeful that better days are ahead and that we're in a more positive position today, but it is important to echo that we acknowledge the hurt, frustration and exhaustion people feel throughout the heart community and beyond. The commitment of the Echo staff and board has been inspiring throughout this pandemic. The way that families have supported each other across social media channels or support groups has been amazing to see. I personally have seen many outstanding examples of NHS staff working tirelessly to care for those in need of frontline care, and how support staff within the NHS and Echo have been supporting those who needed it from behind the scenes. In fact, without the determination of the Echo team, trustees, fundraisers and volunteers, Echo might not exist today. We rely on individuals, introductions and events to support the heart community, and I want to thank them for their support over this time. It's been the hardest period that Echo has faced in our 38-year history, and like many charities, we're still finding our feet and adapting to the ways we work. I've learned a lot about the charity and a lot about myself, how we work together with families, with the teams who support them, and it is an honour to steer Echo through this challenge. Thank you all so much for taking part in the Opening Doors event. We're looking forward to seeing your wreaths and keeping the doors of the heart community open.